Welcome back. We are with Grazel Garcia one more time, and today we're diving into couples therapy a bit more. And we're going to be talking about how many couples really survive couples therapy. Because obviously, you're in couples therapy for a reason, and once that therapy ends, do you actually come out of it in one piece? So, what do you think, Grazel? On average, do they come out of it in one piece?
I think so. I know so. I think what we're looking at, the factors that are really, really important to have couples therapy be successful is both partners being committed to change. That's one big factor because that's going to lay the ground and the foundation of our work together, right? And that means also they're going to be able to finish couples therapy that we do in EFT, where there's three stages.
Mhm.
Um, so I think the commitment is a big factor.
Yeah, I mean, it's very difficult to get two people in a room if they're not committed, particularly if there's some kind of problem between them. Um, what would you what would you say if someone wasn't committed? Let's say one side wants to come, one side doesn't. I know we've spoken about discernment counselling before, but if it's ultimately we want to stay together, but one side's not sure therapy is the right option, say, what would you say to that one person?
There are couples that show up in therapy where one partner is not fully committed to going to therapy, and that could be the reason for not wanting to go to therapy may be coming from many different factors. It could be cultural, it could be financial factor, it could be time. It could be a big fear of really opening up. So I think what's important as a therapist is to assess whether the resistance to coming to therapy is part of their negative cycle.
Hmm.
If it is part of their negative cycle, then just that's just part of the work, right? So I wouldn't necessarily say that couples therapy is not the best if one partner is not open to coming.
Hmm.
That's just part of the work. We can't have every partner in the couple want to go to therapy. And I just want to validate that because that's normal. It's not something to be pathologized either.
Yeah, and therapy's hard. You're going to go to some places that you might not be ready to go to necessarily, and you might be having very, very difficult conversations. Which, if your defense mechanism is to shy away from those things, then yeah, it's not something
Yeah.
you're going to want to go to. Um, it's sometimes like going to the gym, isn't it? You don't want to go, but you know you should.
Right, right. Yeah, because there's a lot of work to do.
Exactly. Um, so when the couple's in the session, how can they tell they're actually making progress? Because it's like when you're raising a child, you don't necessarily see them progressing and developing until you look back at a photo from a year ago and you realize how far they've come. So when you're in the room as a couple, you don't necessarily see that kind of week by week progress. So how can you tell?
How can I tell as a therapist, or how can I tell if a couple is asking me that?
How can the couple tell that they're making progress themselves?
I think that's a really, really important question because that's a question that comes up in every session, whether they're talking about it or not. The couple is wondering,
Mhm.
is this actually working? How do we see the actual changes in therapy? I think this is exactly why I love emotionally focused therapy is because I can see how I move couples from insecure attachment to secure attachment. Insecure attachment means they're coming into therapy in the beginning, not knowing how to be vulnerable with each other. And they're very avoidant of vulnerability.
Mhm.
And the reason why is because they don't feel safe to open up emotionally because they don't know that their partner will be able to give space to hold their sensitivity, right? So, as a therapist, how I can tell that they're moving towards success is when they're practicing emotional openness, accessibility, engagement, and responsiveness to each other. The more they do that on a weekly basis, they're going to be able to tell that, oh, I'm feeling more safe and I'm able to open up about things I'm usually afraid to open up about.
Mhm.
It's not, it's experiential. They're going to experience the change, and that's how they can tell.
Yeah. Yeah. And
Does that
also,
make sense?
yeah, I mean, this is one of the crazy things when we're talking about therapy because it's such an inner world thing. There's no external sign necessarily, although you've spoken before about how the couples get tend to get closer together on the couch as the sessions go on. Um,
Yeah. And I mean, they can tell, as a therapist, I usually ask, how are you doing? How did you do from previous week? What are the things that you've implemented in the work that we did last week?
yeah.
And they usually report back to me if they feel stuck or they don't know how to do it.
Mhm.
So I think a therapist's lead to guiding the couple to a successful treatment is very important.
Mhm.
A therapist needs to be able to check every week to see how they're progressing and talk about it. And also for the couples, you're going to know that you're progressing when you're not fighting as much, but you're also connecting more than disconnecting.
Yeah. And I guess when those fights don't turn into like week long silences or, the fights resolve quite quickly as well, that's another sign.
Yes.
So I'm just trying to think how to ask this. If you obviously go through all this work in therapy and you start, even in couples therapy, you're going to start to understand yourself a lot better. But what if in that process you both decide, we're just not right for each other and decide to separate? How can couples therapy be seen as like a success in that situation? You tried to bring people back together through couples therapy. They've separated anyway. Is there a kind of
Mhm.
silver lining? Is there a success to be had there?
Absolutely. I think the work that couples do in couples therapy can go a long way, right? Um, let's say they came into couples therapy committed as a couple, and then they graduated couples EFT couples therapy. And then all of a sudden something happens along the way while they're not in therapy and they've decided, okay, I really think we're not a match. And, being separated is a better choice for us. As long as they've worked on what got them to be disconnected while they were in the relationship, I think they can still call couples therapy or consider couples therapy a success.
Mhm.
There's just, they probably just grew apart after couples therapy, and that can happen where they grow and then realize, hey, I'm a different person now and I'm looking for something different.
Mm.
And that doesn't necessarily mean couples therapy before didn't work. However, I think what's important is that couples need to know that as therapists, we're only able to work with what you gave us.
Mm.
So if you give us something while you're in couples therapy, that's what we're going to work on. If you don't allow us to get into any parts of you that may be questioning the relationship, we wouldn't know it. So I can't really say that couples therapy didn't work for something you didn't give me,
Yeah.
if that makes sense.
Yeah, that makes sense. And with therapy in general, as I said earlier, it's all about that kind of self-discovery. So you change a lot through a therapeutic journey. And the idea with couples therapy, I guess, is that you're changing together and kind of, in a sense, falling in love with each other all over again because you're learning all these things about each other that you didn't necessarily know. Do you ever find that in your sessions?
I think that when it comes to the work as a therapist, it's so important to know that we're learning from each other. A lot of people that come into the room have their own experiences and stories that I can learn from.
Mm,
And each person is the individual expert of who they are. And sometimes they don't know parts of them or it's very unconscious to them. And that's my job. My job is to guide you to become more fully aligned with who you are, even the parts of you that you don't know about.
mhm.
So yeah, we do learn together.
Yeah, absolutely. Um, great. So, on balance, to answer the question at the start, would you say most couples survive couples therapy?
Most, yes.
Is there
Yes.
a particular type of couple or particular issues with couples that would indicate that they maybe won't survive, they won't get through this?
The couples that survive therapy, again, one important key factor is their commitment to making the relationship work and acknowledging the role that they play in the negative cycle. Taking accountability and responsibility are very important factors to success,
Mhm.
right? And I know that if a couple is committed to being accountable, being responsible, and vulnerable, then they will succeed in therapy.
Mhm.
And if they're committed to actually going and look and, keeping consistent attendance.
Yeah.
Um, for the rest of the couples that I've seen that didn't find couples therapy working for them, were already out of the relationship to begin with.
Yeah.
Before they even came to therapy, the one partner or both partners were already questioning their relationship, questioning to the point of they're already leaning out of the relationship. The commitment is not fully at 100%,
Mhm.
right? So those are the couples that are on their way to separation. I wouldn't really say that it's the modality that's not working, especially EFT.
Mhm.
Um, and again, I can't speak for other modalities, but I would say it's the same for other modalities that if the couple is really already on their way out.
There's not really anything you can do to keep them together because they've already made up their minds. Yeah.
Yeah. So we just kind of join them and, kind of, this is what I can help you with. I can help, provide a path to separating amicably. So that way, you can still have a relationship if you want to do that after separation.
Yeah. Yeah. Okay, brilliant. Well, again, thank you so much for your time. That's been another really interesting discussion, and I'll speak again soon.
Thanks, Scott.